Hi, Dr. McKay. You're on
Hey,
mute.
how are
Yep,
you?
I hear you. Hello to our guest as well. I'm not sure who that is, but thank you for joining the Beautiful Mind Summit. We'll begin momentarily.
And please call me Catherine.
Hi, Catherine. Hi, Catherine. Hi, Dr. Douglas. Probably coming into the meeting now.
I did not get a chance to add the extra slide that you wanted.
I did send it to you if you have the
Let's
ability to
see.
send the last
Let's
email.
see.
We do have a guest in the room, so
Okay.
so you guys are aware people are coming into the room.
Yes, thank you.
If you can't do it, Lisa, it's okay.
Yeah, if you don't mind, let me share the screen with what I have.
I'm going to make you the host,
Okay,
Dr. Douglas.
Perfect.
Is it not letting me do that right now? You know what? I logged in on another thing. Hold on one second. I'm going to go out and then I'll be back.
Okay, so let's see in the meantime, Catherine, whether I can pull your slide.
Yeah, just send it again.
Last PowerPoint slides for 2 p.m. I added it myself. Oh, it's not attached to that. Let's see if you sent it elsewhere. Final with new slides. Okay, let's pull this down. Yep, I had it in my other email. So let's pull this up. Shoot, where is that? Okay, it's downloading. That's why it's not allowing me to do anything. Close that out. Close that out. All right, let's see. This says KM.
Yeah.
All right, let's just make sure everything is there. Shoot, the only problem is, okay, I'll need to work on this a little bit. I added in the animation to my version.
Oh, you did? So don't worry.
Yeah, what page is yours on? The extra slide you added it. I'm just going to cut
right
it
after resilience.
the scale. Okay, I see it. Resilience malleable, the scale. I got it.
Just the scale. That's all I added.
Yeah, so I'll put it in my version because I added in some animation to allow for, okay, let's put it in here. And it comes after resilience malleable, fixed malleable, and right before post-traumatic growth. New slide, paste that slide in, delete. Okay, so let's see. All right, let's just play this, come out of that. Oh, I wonder why it always goes into full screen mode, okay, which is fine.
And can you hear me okay, or should I put in my headphones? I messed with my sound before and was able to.
Okay, so I'm gonna do the screen share. Share. How is it looking on your side? Can you guys see the screen?
Yeah. Yeah.
Okay, I'm gonna put it into full screen mode. Can you guys see that?
Perfect.
Yes.
And I'm gonna run through the slides. Right, so you see this. Okay. Okay, highlight. Okay. Oops, thing missing from there. Uh-oh, something looks missing from there. Okay, let's see what the issue is. Catherine. Okay, so yours will just come out like that. Your scale, CTG, Nathalie. Oh, did you remove the slide with your name, Nathalie? You may have. Okay. So let's go back. Let me stop sharing for now. Let's look at gallery view. Hi, Dr. Conway. Do you guys see Fran is in the room?
Hey, Dr. Conway. Hello, my friend.
Hi, Fran.
All right, so Nathalie, one question for you. Let's escape out of that is, did you want me to put back a slide with your name on it at the beginning of your talk?
Oh,
Yeah,
you could
for
put it
some
on the
reason.
Helen Keller quote.
Oh, yes. Okay, good point. I will just add your name to that. Yes. Building resilience. Oops. Okay, Dr. Nathalie Caldera. Okay. Copy. Put it above. Paste. Let's see how it was done up here. Dr. Catherine McKay. Yep. Dr. Nathalie Caldera. Oops. Put that back there. All right. So we are ready.
Look at you guys using the group chat.
Yes. Just so the speaking of the group chat, I guess Janaba, as our producer, will you be able to monitor the chat for us?
Absolutely, I will be
Okay.
here the whole time.
Wonderful, wonderful,
Mhm.
excellent. And so I will just go through the slides for the whole presentation, and Dr. Catherine and Dr. Nathalie will just tell me to advance, and I will be right back.
You guys know we are recording.
That's what I was going to ask you. So how would participants get a copy of the
It probably would be sometime next week. We will put it somewhere on our platforms so people could see the live recordings. Yeah.
Would everybody have to be registered in order to get that? I had some people I told.
No. We probably will if it's not going to go on the website, it will more than likely go on our YouTube page to highlight the different aspects of the event. And so I'll probably edit this part out and just do the presentation pieces. Yeah.
Okay. Yeah. As people are joining in, hi there, as you're joining, if you want to kind of let us know. We were curious about whether or not folks are more professional or just folks in the community. So if you have a chance to type that in as we're waiting for people to join, that would be wonderful.
Let's see, we have.
Yeah, where are you joining from?
Yeah, like you said, give your name and just let us know where you're joining us from, which state you're in.
Or what you do, right? So are we professionals, or do we want to make sure that we match you?
I'm going to give people an opportunity to unmute themselves or ask them to unmute for now and then go back to muting. So if folks want to introduce themselves, or raise your hand and I'll unmute you. I have one person, Lisa McSell. I think that's how you say it. She may have stepped away, so I'm going to mute her back. But if you raise your hand, and I can see your hand raised, I have Lauren in New Jersey, a social worker at ARFC. Am I saying this right?
Hi, yes, you are. How are you?
Hi, how are you?
Nice to meet you all. Oh, I guess I could do the video too, huh? If I'm going to say hello.
Yeah, everyone can do the video, by the
Hey,
way.
Lauren.
Hi, how are you? Nice to meet
Good.
you all.
How are
Thanks for
you?
joining us.
Thank you for the information. I'm looking forward to it.
Yeah, we're excited to be here to share this information.
We have Dr. Caldera has said something to everyone. And then Dean Francine Conway, who's a psychologist and obviously the Dean of Gazette. And anybody else want to introduce themselves? Come on, people. I'm Janaba. I'm from New Jersey. Yeah, born and raised.
Hey, Janaba.
Hi. I know I should show my face, but it's
Right.
been such a long.
Oh, I bet. Nava and her team are working tirelessly at this process.
Right.
It's a great process, though, especially when you're in on the workshops and you hear the information. It's really a benefit to the community and to,
Yeah. Oh,
you know,
yeah.
our students in school. So
Definitely. Definitely.
still got a couple more minutes, and hopefully, like, people have been coming into the rooms little by little.
Right. How's the attendance so far throughout the day on average? How many people are attending each panel?
Anywhere from 100 to, 100 and some change.
Okay.
Panel. Mm-hmm.
Yeah,
Now,
so
some
still
panels-
technically it's early still. We've got 2
It's still
minutes.
early. There's a couple panels that had maybe about 50 or 60 participants, and then
Okay.
it grows, and then it goes, like, people are jumping through rooms because I think people are wanting to get parts of
Yep.
each.
Thing.
Yeah.
And there's 4 right now happening.
Oh,
Yeah.
okay. Yes.
You guys are highly competitive at this hour. But I really wanted to come to this workshop anyway.
Yeah.
Plus, why
It worked out.
Right.
That's
Yes.
the question to start with. Why this workshop, right? There's a lot of choices out there.
Yeah, this worked. I actually got assigned to this. It's funny because Alyssa assigned me to all the ones I wanted to go to anyway.
Good. Kill 2 birds with
I
one
was like,
stone.
look at the
Help us
universe working for
produce
me. Yeah.
and
Yeah.
learn and grow. Yeah.
That's great.
There's some more people in the room. If people want to introduce themselves, raise your hand or ask to be unmuted, and I will unmute you.
Or you can type in the chat as well
Yeah.
and
Mhm.
introduce yourself.
Ah, there's
I
Mrs.
see a familiar face.
Oh, I know that person.
Hamish.
Family support. You gotta love it.
Oh, that's amazing.
She's in London right now, stuck there.
Oh, wow.
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 With the time difference, and still you're choosing to come to your sister's presentation. That's a very wonderful
That's
thing. That's good
amazing.
social support right there.
Good
Yeah.
social support.
Yeah.
The room is
So-
filling up. We have.
Yeah.
Oh, somebody said, of course. Oh, okay. Oh yeah, very good support. That's awesome.
Yeah. Yeah. So in the spirit of starting on time and ending on time, I'm going to get us started because we have a lot of information to share today. So welcome to our panel on living resilient, accessing your muscle during hard times. So I'm going to share my PowerPoint screen, and this should give you guys a full screen, and you can play with how you want to see the screen along with the presenters that are speaking. We're first going to do introductions. My name is Dr. Licia Ruglas. I'm a licensed clinical psychologist in the states of New York and New Jersey, and my clinical and research interests center on the assessment and treatment of stress, trauma, post-traumatic stress disorder, and substance use disorders. Dr. McKay?
I'm Dr. Catherine McKay. I'm a licensed psychologist. I'm presently in Florida, but did my training in New York, and I'm licensed in both New York and Florida. Areas of specialization in my private practice are couples and trauma, and have research experience in attachment, looking at relationships, and how to really set a strong foundation for surviving trauma. Dr. Caldera, please.
Thank you. Welcome, everyone. I am Dr. Nathalie Caldera. I am a clinical psychologist licensed in New York and New Jersey. I am the founder and director of Let's Talk Psychological Wellness. We are a group of 21 licensed mental health professionals dedicated to providing superior psychotherapy services to adults with anxiety, panic, trauma, PTSD, and alcohol misuse. Dr. Robles.
Welcome, everyone. So we wanted to start off with a quote from Nietzsche, which many of you might be familiar with. That which does not kill us makes us stronger. But we have a caveat. Well, it depends. So I'm going to first start in my segment with defining stress and trauma. What are the distinctions? I'm going to talk about what are the risk and protective factors involved in stressor-related or trauma-related reactions. And I'm also going to talk about the typical acute and long-term reactions associated with stress and trauma. So what is stress? And actually, Deepak Chopra talked about this a little bit last night. Stress results from the perceived demands placed on us at any given moment. Stress is very common, but it's also very subjective. What is stressful to one person may not be stressful to another. People respond to and cope with stress in many different ways. Not all stress is bad or negative. We know that there is positive stress, and some stress can actually help to catapult you into taking action on things that you've been stalling on. Stress may come from a variety of sources. We know environmental demands can create stress, noise, traffic. We know social demands can create stress, work stress, relationship challenges, financial challenges, competing demands for our time. We know physiologically when we haven't eaten well, when we haven't slept, when we're ill, as we're getting older, we're experiencing age-related changes, that these can also be sources of stress. We also know cognitively how you appraise or think about the situation determines the level of stress that you experience. And then when you up the ante in terms of stress exposure, there are also traumatic event exposures, which can contribute to traumatic stress. Now, we know that when stress accumulates over time, when it becomes chronic, when your coping resources become ineffective, then stress can take a toll on your psychological and on your physical health. So we want to distinguish stress from trauma. So what is trauma? The Substance Abuse and Mental Health Services Administration defines trauma as an event, series of events, or set of circumstances experienced by an individual as physically or emotionally harmful and threatening. And that has long-lasting adverse effects on the individual's functioning and physical, emotional, and spiritual well-being. We know that the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, they have a highly specialized definition of traumatic event. And they argue that a traumatic event is one that involves exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. A person could directly experience a traumatic event. A person may witness in person as it occurs to someone else. A person may learn about the traumatic event that has happened to a loved one. It may be a violent event or an accidental event. And a person may experience repeated or extreme exposure to aversive details of a traumatic event. And we're talking about the first responders. So a big question, well, first, here are some major types of traumatic events. I'm not going to go into all of them, but we know that up to 90% of people will experience a traumatic event in their lifetime. And so a big question that we're asking now that we're in the COVID-19 pandemic is the COVID-19 pandemic a traumatic event? And I would argue, yes, that it could be considered a mass trauma. And here are some reasons why. It's an unusual, unexpected event that we're all experiencing associated with actual or threatened death. Some of us may have family members, friends, or colleagues who may have gotten sick or died from COVID-19. We may have learned about or witnessed someone who has gotten sick or died from COVID-19. We may have even experienced repeated or extreme exposure to aversive details of COVID-19 via the media, so TV and social media. We know that racial ethnic minorities are disproportionately affected by COVID-19. As of this reading, 4.36 million confirmed cases of COVID-19, 150,000 people have died, and racial ethnic minorities are at increased risk of getting sick from and dying from COVID-19. According to the CDC, this is likely due to discrimination, limited healthcare access and utilization, and the occupations that racial ethnic minorities tend to be involved in. Given educational, income, and wealth gaps, racial ethnic minorities are likely to be in occupations where they are on the front line, which enhances their risk of exposure to COVID-19 and ultimately death. We're also at the same time experiencing what is known as racial trauma. And how do we define that? Racial trauma, these are traumatic events that occur as a result of witnessing or experiencing racism, discrimination, or structural prejudice, also known as institutional racism. And this can have a profound impact on the mental health of individuals exposed to these events. So the recent events that we're seeing, the police killings of Black men and women, we are experiencing overt and covert experiences of microaggressions and discrimination against Black and brown people. We see the social unrest, we see the protest, and we're also seeing disproportionate police responses to Black people and brown people. Racial trauma, also known as race-based traumatic stress, refers to the stressful impact or emotional pain of one's experience with racism and discrimination. So we do want to make a distinction between racial trauma and PTSD. Post-traumatic stress disorder, typically the traumatic event is in the past. In contrast, the racial trauma tends to be ongoing because the racial trauma, the exposure to racism and discrimination, is ongoing in the present moment, which can lead to complicated post-trauma or ongoing trauma reactions. Now, we know that the way in which people experience a trauma, what makes a trauma response more likely, more intense, and more complicated has to do with three sets of variables. The first set of variables has to do with the characteristics of the victim. We know that age, young age, is a variable that's associated with more complicated post-trauma reactions. For people that experience childhood trauma, it's likely to cause severe psychological outcomes because it's occurring during a developmentally vulnerable time. It's often of long duration, it involves relational trauma, and it's likely because of the young age over time that that person is going to have multiple victimization experience. We also know that female gender is a risk factor associated with more complicated trauma reactions. Despite similar rates of trauma exposure between men and women, women are more likely to be exposed to what we call high impact trauma. So rape and childhood sexual abuse, which is often associated with more complex trauma reactions. We know that having a prior history of trauma, it also complicates the matter because as you continually are exposed to traumatic events over time, you're more likely to have what we call cumulative trauma or complex trauma. We also know that characteristics of the trauma itself. Was this an intentional act? Did you feel like your life was threatened? Were you injured at the time? What was your proximity to the traumatic event? As we mentioned before, if you're on the front line witnessing the event, trying to, like the COVID-19 medical workers, you're right there on the front line, trying to help that person, you're close to that traumatic event. So you're more likely to have a detrimental post-traumatic reaction. We also want to be thinking about the factors such as social support and social responses. I'm sorry, I'm having issues with my mouse. We know that lack of support from family members, friends, and others is associated with more negative post-traumatic outcomes. So how did family members react to the victim's traumatic experiences? Were they responsive and supportive, or were they harsh and critical? We know that social acceptability of the trauma contributes to the social response. So whether it's rape or combat or a natural disaster, we know that society deals differently when somebody has been exposed to a natural disaster versus, let's say, a rape, where we find a lot of victim blaming and shaming. We also know that the view of the trauma survivor is also critical. If you're a racial ethnic minority, if you're a woman, if you're an immigrant, if you're homeless, there might be more stigmatizing views of you, which may be detrimental towards your post-trauma recovery. These are also some other factors that are associated with trauma reactions: your level of coping skills, your level of intelligence, your physical health, your self-esteem, having a positive racial or cultural identity. These are all linked with better outcomes. So in my last 2 minutes, I'm going to talk a little bit about some acute and long-term effects of trauma. So acutely, people may have physiological or bodily responses, sweating, diarrhea, headache. The person may have emotions and feelings such as anxiety, fear, sadness, anger, guilt. Behaviorally, the person may have trouble falling or staying asleep, outbursts of anger. Cognitively, the person may have trouble remembering things, trouble thinking clearly, trouble concentrating, feeling confused, and worrying a lot. We know the long-term effects of trauma are detrimental. The person may end up with attachment issues, having difficulties with initiating and maintaining healthy relationships. There may be a loss of trust, feeling distrustful and suspicious of others. There may also be social isolation, withdrawal, aggressive or negative interactions with others. Additional long-term effects involve self-regulation issues. We know that approximately 7 to 10% of individuals will develop PTSD in response to a traumatic event. And depression and anxiety disorders are also common responses to trauma exposure. We know that among those with trauma exposure and PTSD, 30 to 75% of those will develop drinking problems. And 25% may have a co-occurring alcohol or drug use disorder. And these are just some additional behavioral and emotional problems that we might be aware of. So the big question, erosions of self-esteem, poor self-image, low self-confidence, and destructive behaviors. So a big question before I pass it over to Dr. McKay is, so why isn't everyone symptomatic? Studies show that there are multiple trajectories after exposure to loss and trauma, and that actually resilience and recovery are two of the most common outcomes. So we wanted to focus the rest of the panel on what is resilience, how to build resilience, and how to cope so that recovery is one of the outcomes. So I'm going to turn it over now to Dr. McKay to talk to us more about resilience. Dr. McKay?
So let's start off with between resilience and post-traumatic growth. And next slide is the thing that I want us to kind of focus in on is what we would think about as coping. Strategies, behaviors, it's a response to stress. And what we know is our brains are wired for survival. So
looks like you're having some connection issues. Anyone else seeing that?
Yeah.
Let me give her a text just to alert her. Okay, it looks like she closed out.
We'll wait a minute.
Yeah. do this. I see that she's back on, but not her video. Let's give her one more minute, and if she doesn't come on, perhaps we can jump to Dr. Caldera's segment and then work our way back, potentially.
Or what I was thinking is that if anyone had any questions that we can
There's a
answer.
question in the chat that says, while we are waiting, from Michelle Caldera, can one of you speak to people not recognizing their trauma?
I mean,
That's a great question. You want to go first, Alicia?
That's a great, right. How does one become more aware of whether they've experienced a trauma or not, right? You know, as I mentioned earlier, the trauma response, there is a subjectivity involved in what we consider stressful or trauma, right? So objectively, someone may look outside and say, oh, you were beaten by your father when you were growing up. That's a traumatic event. And, you know, I've heard people say, well, I deserved it. I didn't see that as a trauma. You know, I was acting out in some way, you know, not necessarily seeing that as a traumatic event. So that is possible. And what would one want to do about that? And maybe Dr. Caldera can jump in as well, because a key piece is how one interprets the event will determine the reaction to the event. And so if this person doesn't perceive a life event as traumatic, even though it may be having an impact on their behaviors, right, what does that mean for that person's life? What does that mean for treatment when we start working with someone like that? Right, is a part of the work getting to that place of recognizing that that event was traumatic, or what else would we want to do? Nathalie, do you want to say something about that?
Yeah, I mean, I would say that it's okay to just focus on what you acknowledge is happening currently. So whether or not you're there in treatment to talk about the maladaptive behaviors that have caused trouble in your relationships or caused trouble in your work productivity, for example, that perhaps that's a way of talking about it that you can acknowledge today. But I think that Licia is correct. What we do know, as Licia mentioned, is that everyone does, you know, a majority of us may experience at least one traumatic event, but the critical piece of information is that 70 to 90%, most of us will be resilient or recover.
I've just got a text from Dr. McKay that she'll be back on.
Is it true? Here's another question.
Okay.
Is it true that who has trauma experience in life is more prone to have it again?
There's definitely some literature, especially if it's childhood exposure to trauma. We know that for people that are younger, when they've been exposed to trauma, depending on their coping strategies, depending on a lot of different factors, there may be a chance that they will be re-victimized later on. And there are lots of different factors that play into that. There's not a one-to-one between, let's say, having a childhood exposure and then later going on to having more re-victimization experiences. But we know that for people who've been traumatized, you know, if they haven't received support or treatment for the trauma exposure, they may end up in situations because of poor threat detection or because of substance use, maladaptive coping. They may end up in situations that make it more likely that they would be exposed to a trauma in the future again. So, you know, I definitely think early trauma makes you more vulnerable to later victimization, but I think there's some intervening variables. It's not a one-to-one. Certainly if they enter a destructive relationship, certainly if there's substance use involved, it certainly heightens the risk of being exposed to a trauma later on.
Yeah, and I would just add to that, yes, you are at greater risk, and especially greater risk if the prior trauma was one of an interpersonal nature.
Right.
So if it was an interpersonal nature, and if it was in childhood, early childhood, if it had been prolonged, exposure to traumatic events also puts you at increased risk for future traumatic events, but also for future development of post-traumatic symptoms.
Sorry, I didn't grab that last question. I was emailing Dr. McKay
Yeah.
just to see where she is. Yeah.
Okay.
Yeah, I'm thinking, Nathalie, a good plan is for you to go through your slides and then she can come back and talk about resilience, just so we don't miss the rich information that you have.
Yes. That would be great.
Okay, so
Happy
go
to
ahead.
do that.
Yes.
So in the past 2 months, in our practice, we have been overwhelmed with calls and emails seeking help. Many of those calls are from people who are realizing that more than 4 months in, we still don't know when this will end. As we move through the summer, the United States is continuing to add new cases to this COVID-19 disaster. In the US, as Dr. Ruggles mentioned, more than 150,000 families are grappling with grief over the loss of a loved one. Although the world is full of suffering, it is also full of the overcoming of it. This is a great quote from Helen Keller as we move to talk about ways to build resilience. We must remind ourselves that we are living through a collective traumatic experience. However, while we are all in the same storm, we are not all in the same boat. While we are all witnessing this disaster, as well as witnessing the continuous fight against systemic racism, we are each experiencing different stressors. Some of us have contracted COVID-19, some have lost loved ones. And while we do believe that systemic racism affects all of us, some are directly affected while others are not. When looking to the future, we must ask ourselves, what can we do better to manage our overall mental health? As people are realizing, the most important thing is to notice warning signs and get help early. We urge you to make it a part of your routine to monitor your stress, monitor your anxiety, monitor your sadness and frustration levels. Dr. Ruggles offered an excellent summary of stress, trauma, and PTSD. She emphasized that all of the research shows that most of us, 70 to 90% of us, are resilient in the face of trauma. Dr. McKay will give you a summary, an excellent summary of resilience and post-traumatic growth. Doctors McKay and Ruggles both emphasize that there are risk and protective factors when facing trauma. We highly recommend a proactive approach to resilience building. This is where you anticipate and plan for how you will cope with difficult experiences. In general, we want to focus on the things that you can control rather than the things you cannot control. So get up, get dressed, maintain your routines. As we look to the future, wherever we can, we want to continuously build our resilience muscle. And Dr. McKay will talk about that. Our goal is to have minor disruptions in functioning with few significant interruptions of our everyday routines. We're seeking to help you reduce stress and prevent chronic stress. The good news is that resilience building involves behaviors that are ordinary, they can be learned by anyone, and can be a personalized process. As Dr. McKay will emphasize, resilience is dependent on many factors, and that these are additive. Some factors are fixed, such as personality traits, and some are more malleable, such as socioeconomic status, or whether or not you already have a history of trauma, PTSD, depression, anxiety, or substance misuse. We also recommend a strengths-based approach. Remember, not one size fits all. Remember to review the skills that you already have. You want to review your accomplishments, review the sources of strength in your life, and draw on the times that you felt safe and comforted. Skills that you practice should also be culturally relevant to the life that you are living. It is also very important to remember that skills that worked in the past may not work today. So you may have been resilient in a past disaster, but not in this one. And that it is important to erase the shame and the stigma about getting screened, getting evaluated, or treated by a mental health professional if needed. Today, I will focus on 5 ways to build resilience. You can practice 1, 2, or all 5. First, the quality of our close personal relationships is the most significant determinant of resilience. So practice limiting your social media and the news to once per day, preferably in the morning. Instead, you want to engage your social support network. Discuss what's happening. It can be helpful to emotionally process your past and present experiences with those that you trust. Those who are non-judgmental, those who can validate your experiences and be supportive. These can be family members, friends, like-minded colleagues, spiritual leaders. Finding other people who are going through similar experiences and who may have similar feelings to you that you can talk to about what you're going through can help to normalize and validate your experiences. Knowing that you're not alone in this experience and that your feelings are normal is super helpful. It is important to put some consideration into who you choose to discuss your experiences with. Some people may not be able to listen without judgment, and others may not be able to provide the support that you need. So pick wisely. You would not pick the office gossiper to talk about deeply personal, private, and sensitive information. Spiritual and religious practices may also serve an important role in building resilience and harnessing your social network. Praying, reading, participating in religious services with community members can help you feel a sense of strength and a shared grief. It can provide a greater sense of meaning, and engaging your social network helps to remind you of your sources of strength and support. Second, you want to arm yourself with knowledge. Remember that stress and anxiety in moderate levels is your friend. It helps you to plan and it helps you to prepare. Anxiety is fear of what might happen in the future. So given what is going on right now, it is normal to have stress reactions that then lead to anxiety. The good news is that anxiety has a purpose. It is here for a reason. It is a normal human emotion. It helps you to prepare to deal with the threats you are facing. The problem comes when the levels of anxiety go beyond moderate into excessive levels. When you find yourself worrying all day about things you've already planned for, you've already prepared for, things you have no control over, or things that you've already calculated have a low probability of happening, and especially when it's interfering with your sleep, your appetite, your work productivity, or your relationships. You especially want to watch for this and work on knowing when stress and anxiety is excessive for you. It is important to look out for key signs. So your key sign might be catastrophic thinking, thinking about the worst things that could happen. Or for others, your key signs can be physical. Anxiety can manifest itself as tightness in the chest, shallow breathing, clenched jaw muscles, frozen shoulders, skin breakouts, appetite changes, or crying spells. So know what your signs are. Arm yourself with knowledge. As you practice monitoring yourself for key signs, also practice acknowledging and accepting. So label and name your emotions. Increasing your awareness is key. It's common for everyone to push through stress, push through fatigue, push through anxiety. We often see admitting to these things as a sign of weakness. Instead, it's better to accept and label your anxiety, even though it's uncomfortable. So label what you're feeling. I'm anxious, I'm frustrated, I'm stressed, I'm sad. You can name it whatever you want. In my Guyanese culture, we might say my nerves, my energy, my uneasiness. Labeling it, naming it, puts you in the driver's seat. Also, practice measuring your emotions on a scale of 1 to 10. This helps with the process of managing them. Measuring it also makes you keenly aware of who and what triggers your stressful responses. A certain person, a certain kind of email, a certain behavior, a certain place or memory, and it puts you again in the driver's seat. When you measure it, you can even learn to predict it. Decades of research on emotional intelligence show that people who understand their emotions and their own feelings have higher job satisfaction, better job performance, and better relationships. They are more innovative and manage conflicts more effectively. Arm yourself with knowledge. Third, you want to practice challenging negative thinking patterns. An easy model to follow is the ABC model. A is a negative thought, B is the feeling, and C is the action you take. For example, if my thought is, I'm a failure, this may lead to me feeling sad or anxious or frustrated, which then might lead me to stop calling my friends. This may then become a vicious cycle. Writing your negative thoughts down interrupts this cycle and allows you to challenge the negative thoughts and replace them with correct ones. Write it down. A good practice is to set a worry time of 15 to 20 minutes. For example, tomorrow at 12 noon, I will spend worrying about X problem or Y problem and practice challenging my negative thoughts. Fourth, while it's important to monitor and manage negative emotions as well as challenge negative thinking patterns, it is just as important to cultivate and build positive emotions. So you want to cultivate laughter, practice using a gratitude journal daily. At the end of the day, you can practice the what went well exercise. For this exercise, you name 3 things that went well that day and why it went well. You can also practice mindfulness exercises such as journaling, yoga, guided meditation, breathing exercises. These all help you to stay present and restore hope, even in the most trying times, and helps you to maintain an optimistic view of the world, which has been shown to correlate with better outcomes in the face of trauma. 5, you want to use your voice. The daughter of my high school classmate, Kiara Hardin, and team created voicesarepower.org. It's a great website to use your voice. Remember, your voice is your power. Get involved in social action. Not everyone can march, not everyone can afford to donate, but we can all take action by contacting our representatives at the city, state, and federal levels. We vote in less than 100 days, but participation should not end with voting. We must stay engaged to keep our representatives accountable. The inequalities in healthcare that have been highlighted by the pandemic, as well as the systemic racism that we experience here in the US, are all continuous challenges that we face. So participate in organizations that engage in anti-racist practices and action. Using your voice can increase your sense of hopefulness and enhance your sense of empowerment. Other skills to practice include making meaning of what we have experienced. It is important to remember to make a decision about what the meaning of your experiences are versus a continuous search for meaning. So searching for meaning have been associated with poorer outcomes in the face of trauma. So you want to make a decision about what this experience means for you. Work to set goals and take steps to reach them. This often requires many steps, but is also another opportunity where you can use your social network to keep you accountable and provide encouragement. It also goes without saying that you practice self-care activities that support healthy sleeping, nutrition, and exercise habits. These are additional areas to engage your social network for encouragement and support. Thank you so much. We are going to go back to Dr. McKay.
Okay, are you here?
I am here. So let me tell you
Okay.
about resilience, people. So
Yes, welcome back.
when you live your life on Zoom for your living and your internet goes down, the world becomes an incredibly shaky place. So I am so sorry about that. My internet is still down and I am in my driveway with a phone. So I don't know if Dr. Ruglas and Dr. Caldera went over my slides or not, but what I do
No,
want
we
to
did
know,
not.
oh, you
We
did not. So let
Yeah,
me
so if
to, yeah,
you want
jump
to
ahead.
throw some
Yes,
ideas in,
I'm
if you
gonna
could see the
run through them.
slides. Yeah.
Yes, I'm going to run through them again. I'm so sorry. So this is a picture of resilience and coping right here. So the distinction between coping and resilience. So coping is when we're facing stressors like your internet goes out in the middle of a presentation and you figure out what do you do then? You could either panic and put your head between your knees, which I chose not to do in the moment, and instead figure out some behaviors that would be helpful. So you do strategies, things that can assist you to go through the process of survival, because survival is key, but we must maintain a sense of adaptation and creativity in doing so. So I know there's some things that are internally and externally focused as we try to cope. When I'm internally focused, I'm trying to measure, how do I think about my breathing? How do I kind of regulate my heart rate enough right now? Focused on external, maybe how do I hit the internet cable box through the window without breaking everything else in my house? But I choose to do neither of those things. Next slide, please. Resilience, though, is a little different. Resilience we think about as a little broader than coping. Resilience is really a capacity that's beyond just strategies, but it's some characteristics, some things that we know can help us grow and bounce back from struggle. Next slide. So I want you to think about resilience as the umbrella and coping as the ribs. It's what holds it up, but it goes far beyond that. What we know is that there's certain things that we have in terms of characteristics, internal as well as external things that we can tap into for resilience that I'm going to go over. Next slide. And some of them are predetermined. So my girl Serena, I love Serena. I work out and I am never going to look like Serena Williams, no matter how many hours I spend in the gym. So I want you to think about there's a baseline that we may all have, but we want to expand ourselves to that potential. So internal, the fixed characteristics of resilience that you may not be able to change are things like intelligence, temperament, your genes. And we also recognize there's some other pieces that we don't really get to choose, like family, right? So you don't get to choose who you're born to. You don't get to choose attachment style or the parenting style of your parents, but we know those things also affect resilience. Next slide. Environmental factors are some other things that are really fixed at times. We really are talking about issues of safety and stability, which are key to resilience. And what we do know is that people who are experiencing economic or racial trauma, people who are facing social factors that limit their levels of stability in the world, have lower levels of resilience. And the map I have up here just gives us an example of 10 of the safest versus the most dangerous cities in our country. And what we know is the experience that those people born in those zip codes have may be very different. Next slide. So the issues that we want to talk about are the ones that are malleable, the ones that we may have some impact on. So sense of mastery, which has to do with the confidence, the worth, self-control, has to do with the ability to measure your perseverance, being disciplined, foregoing impulses. And self-efficacy has really the ability to see a goal and take steps to carry it out. Next slide. Emotional regulation is a key factor of resilience that we can help to develop, and it really focuses on making sure that you pay attention to what's going on emotionally. I know Dr. Caldera went over some of this in terms of the how-to, but the other piece that I want to highlight is psychological flexibility, and that really has to do with the ability to focus on a goal, be perseverant, be locked in, but also have the ability to shift, know when this just isn't working anymore. So when I'm sitting in front of my computer for I don't know how long, trying to get it to work and needing to figure out where else can I go, knock on neighbor's door, who else is home that I can tap into their internet, and here I am on the phone in my driveway. So we also need to have a sense of humor, because if you don't laugh, people, I'm talking about it, and if you don't laugh through it, somebody is going to die. So you know what? I'm not going to die today. And that's something that I can look at in terms of a positive way. Next slide.
Resilience.
Social functioning is the key factor that the research has really shown, the ability for you to tap into social support. And we're not just talking about the amount of people you have on Facebook as friends, but the people that you call at 2 in the morning, the ones that really know you, you feel known by, safe with emotionally, that is key. And we need that in our lives. Religious affiliation, having a faith outside of yourself, is shown to be a key factor in resilience, as well as your perception about the future, whether or not you're more optimistic or pessimistic. We do know that some of the research indicates that optimism is something that is an internal state, that some people are just born more optimistic, but we do recognize that it's a muscle that we can continue to build and develop. Next slide. Here's the scale that we've put together that I put in here that we can kind of tap into, and I'll put up resources later on to take it, but it really gives you a nice kind of clean little snippet of where you are, a lot of validity behind the scale, and we'll put that up in the chat, or make sure that we get this resource out to you so you can take it later on and see where you fall on there, and then take it again in a year after you put in some of the skill sets that we're encouraging you to do. Next slide. Post-traumatic growth is what I really want to end on, and that is far beyond resilience. If you think about resilience as that palm tree that bends and comes back, post-traumatic growth is bigger than that. It's transformation. It's facing a challenge, facing a trauma, and now it allows me to transcend that and become even greater than I was before. And the research really started off looking at Vietnam vets who were prisoners of war. And what we found from these folks is even though they'd endured years and years of torture, isolation, starvation, they still had remarkable ability to cope and be resilient through it beyond what we expected. Their PTSD rate was so low, 4%, and we would think that it would be higher. And what we found that there are certain things that are classically found in people who have post-traumatic growth. Next slide, please.
Dr. McKay, before you continue, I just wanted to let you know you have time. We don't have another workshop, and I don't want to keep you till 4, but we can go over the time allotted.
All right, thank you so much. I
You're
appreciate
very
that.
welcome. No problem.
Okay, so we're on fire here. Okay, so the thing I want you to know about post-traumatic growth, as I said, is more than just the I'm here in this moment, bouncing back, gritting my teeth and getting through this. It's being able to move beyond the trauma to a new experience. And there's 5 categories that we want to highlight around that. If you go to the next one, please, Dr. Ruglass. So here are the 5 we want to spend a little time talking about. First one, perceived change in self. People who have post-traumatic growth following a trauma are people who see themselves now as stronger. And this is only revealed through going through the trauma. Even though you go back and you ask people, would you want to do this if you had a choice to go through this hellish experience? No. But what do I learn about myself in it is that I'm capable. It allows us to see our strength in a deeper and more powerful way. And that change in self, view of self, also leads to a change in a philosophy of life. So now we see life not as this thing that I'm just bearing and getting through, but the way that I make meaning of it changes. And this also shifts from this place of it's limited to now a belief system that expands beyond me. Expands beyond just the life that I'm living. So it ties to things like legacy, it ties to things like spirituality and faith, and it also moves to a place where it strengthens my belief system.
Catherine, we're having a hard time hearing you. Your voice has gone out.
Oh, sorry, can you hear me now?
Come a little closer.
Okay, I think that it probably is a great idea to tackle the questions in the chat. And somebody
Yes, so let's stop sharing the screen so we can go back to a bigger platform. And everybody can see each other. We have about 50.
Yeah, we're so bummed that our colleague has had these issues. We're happy that she was able to join us and give us the great information.
Yeah. And so we highly encourage people to unmute themselves if you have a question, or use the raise hand function. There's
there are 2 questions already in the chat.
Okay. There is one that's up above that I sent to Dr. Ruglass on PTSD. Are you talking about that one, Dr. Caldera?
Yes, and then I saw an easier one down below that says,
so I can respond to that.
PowerPoint.
Yes.
So that's probably a question for you, Janaba.
Yes.
Yeah, you can. Is it inside of the resource room?
I will add it to the resource room. Okay, so why don't we start it? Is it true that to get over PTSD trauma that you have to talk through the whole event and learn to deal with it in order to get past it? It seems like torture to one that's already been traumatized by sexual trauma doesn't want to discuss the disgusting details. And so first I want to say it's normal, it's understandable that you don't want to face those traumatic memories, that they are painful. It's really hard to go back and revisit painful memories. And there are kind of 2 forms of treatments that are out there. On the one hand, there are treatments that argue that you do need to face the memories, that you do need to talk about the memory, emotionally process the memory, relive the memory in order to get over it. And so these are treatments like prolonged exposure, we call it past focused, sort of memory processing treatments. And we find that when you are able to face the memories and process the memories, that you can make sense of the memories, and it can help you shift the beliefs, the maladaptive beliefs that you've developed about yourself and others in the future. You can integrate it into your life and shift maladaptive beliefs when you face the trauma. On the other hand, though, there are studies that say and treatments that say you don't necessarily need to relive the memories or retell the traumas. You can stay in the here and now and look at the impact that the trauma had on your sense of yourself, your views of others and the world. And from a cognitive perspective, you still would want to try to understand, how did the trauma, what kind of impact did the trauma have on you? Did you internalize negative views about yourself or the world or others that you would want to consider shifting because they're not adaptive in the here and now? So you do not necessarily have to go back and reprocess and remember the memory, but you would want to think about how the trauma is impacting your sense of yourself, your view of the world, and whether the impact is maladaptive, and consider whether you would want to shift those views in some ways. Dr. Caldera?
Yeah, and I would just add that, you know, you want to make this decision in consultation with a professional who has experience in treating people who have a history of trauma. So oftentimes, you know, professionals may not necessarily specialize in these areas. So if you're able to find someone who specializes in treating your particular kind of trauma, it's also, you know, more helpful to ask this particular question, like what intervention might best work for me. I don't know if Dr. McKay is able to.
Can you hear me?
Yes.
You want to reconnect your mic. If you're using a wireless mic, reconnect your mic or go directly to your phone. I think you're having.
Can you hear me now any better?
You're very low. We can barely hear you.
Voice here. Can you hear me better?
No.
All right, let's try that again and maybe go to the next question.
Yeah, so I see, thank you so much for this wonderful presentation. What would you tell a parent who witnessed the attempt to suicide from a son who almost lost his life and not wanting to seek help? Dr. Caldera, would you like to take a stab at that?
So, what did you tell a parent?
It's a tough one.
It's a tough one, right? I mean, I'm wondering if it is the son who is not wanting to seek help or the parent not wanting to seek help. In any case, I think, you know, I'm happy to hear that your son survived this attempt, and that what we know is oftentimes someone who has thoughts of suicide or who has made an attempt, 90% of the time has an underlying mental health issue. So you do want to consult. And what I usually tell people is that, you know, you don't have to commit to long-term treatment, but you can consult with a mental health professional, ask questions. Many mental health professionals are available for a free screen when you call them. And you can ask these questions, that there may be other sources of support that don't involve going to a therapist's office. So it may be that your son can be involved in a group in the community, interest that he has, whether it's, you know, something socially or sports-wise, academically. Those may be a first step in getting help.
Yeah, great advice, Dr. Caldera. Just adding to that, as I've thought about it some more. First, I would say it's a horrific and traumatic experience to witness a son try to attempt suicide. And if we think about all that we've talked about today in the seminar, the panel, right? How did the mother react or interpret the event, right? How is she perceiving the event? Is she blaming herself? Is she feeling guilty, ashamed? Or, right, how the nature of the perception of the event and the reaction to the event is very telling. Is there some resilience to the event? Is she actively coping with the event? Or is she devastated and highly distressed and overwhelmed. And in either case, I think the individual has to have that personal motivation to want to seek help. We can't force others to get help. That person has to want to get the help themselves. Certainly we can offer available resources that might be available, but ultimately it's up to that person with the information that they have, whether or not they would want to seek treatment or not. But as a clinician, I would want to know more about how the mother is reacting or responding. Is there high levels of distress, or is there coping and resilience? That's a very difficult situation for anybody to go through. But again, there are risk and protective factors that determine how someone could potentially respond to that. Dr. McKay, welcome back.
Thank you.
Please respond in the group to say, the woman who I guess asked the question, thank you, we are in this journey 2 years already, that is me. That is why I'm here, using the metaphor of putting my mask. That's what she said.
Yeah, excellent,
Oh, yes.
excellent. That it's hard for us to
Thank you
witness
for
other
being,
people.
yeah, and
Yeah,
for being vulnerable
Yep.
in the face of such a difficult experience.
Yeah, excellent. Dr. McKay, why don't we have you say some last words? We can stay on for 5 more minutes. Unfortunately, I'm not able to continue until 4, and neither is Dr. Caldera, but we could stay an additional 5 minutes if there's some additional questions or some final parting remarks that Dr. McKay would like to share.
So I know, thank you, my colleagues, for carrying the load and talk about social support and when it matters, right? To have people with you who walk with you. I heard parts of the questions that came up. So the pieces that I just wanted to add to that was that there are approaches in treatment that have been shown to be effective for treatment of trauma. And we think about things like you mentioned prolonged exposure, but I'm also trained in eye movement desensitization reprocessing therapy, which is an approach of trauma treatment that works through the trauma without having to talk the whole thing out. And what we know is the brain kind of holds an image, it holds the sensations in the body. There's some key things that we keep holding on and kind of get stuck in, and that may be a really effective approach for some people who aren't able to go through prolonged exposure, which I'm also trained in, but I know not all people can kind of endure that process.
Dr. McKay, can you also kind of sum up those last points you were making about change in perception of the self?
So post-traumatic growth is the piece that I want to kind of go back to. So the meaning making, and that mother who, my heart is out to you, that you've gone through this and that you're continuing to seek. And, you know, that metaphor about putting my mask on and going out there, it really kind of goes back to how we find meaning in things. So we don't get to control the things that happen to us in this world. We just don't. But what we can have some semblance of control over, just the thin little slices. How do I respond? What do I do with it? And where are the places where I can tap into resources? So post-traumatic growth is one of the things that, and resilience, one of the things that we have been able to really look for in the literature to say that people can recover and there is hope afterwards. Just like our bodies, when your body gets a cut, it's a natural movement towards healing. The brain naturally has that movement as well. What we need to do is foster the environment and provide the support it needs in order to do exactly that.
Couple comments in the group. Thank you so much for this wonderful presentation. What would you tell a parent? Oh, we already did that.
Yeah.
Thanks so much. We appreciate the feedback. Dr. Caldera, sorry. But a lot of great feedback, and thanks to from the audience. If anybody else has any other comments, someone wrote here, can I get your information on the eye movement treatment for PTSD? Exposure therapy has not worked for me for years and seems to re-traumatize me. And that fast, Dr. McKay.
I just put it in the chat. If you check EMDRIA, it's the research brand of the EMDR organization. It gives you lots of research. It talks about, it's approved by the World Health Organization, National Institute of Mental Health, Department of VA. So you can get lots of information. And another resource that's wonderful is the ptsd.gov. And I'll put that in the chat as well. Website. And that gives lots of resources for both family members as well as individuals who may be suffering from the aftermath of trauma.
Mhm. There's also cognitive processing therapy without, right, without the retelling of the memory. You know, it focuses on how your beliefs have changed in response to the trauma in areas of self-esteem, intimacy, beliefs around safety, who you can trust, that focusing on and shifting how your beliefs have been impacted can also be helpful to the recovery process as well.
And that
So,
goes back to what we were talking about the meaning making, that
right,
that's the part that trauma shifts for us, right? It shifts the way we see ourselves and the way we see the world and our safety within the world. And if we're able to really attack those things, the things that happened, period, in the past, we can't change, but the way we make meaning of it and going forward is really where we can have some hope.
yeah.
And then someone in the chat says, thank you, exposure therapy does not work. And what I want to comment about that is that, you know, I think that it's important, again, the point about finding a provider who has experience in that area would really do a screening and evaluation to see whether or not that intervention is right for you.
Right.
Because yes, you know, all interventions will not work for everyone. It really
Right.
depends on, you know, your levels of resilience, what kind of trauma you experience, you know, whether it was interpersonal or not, all sorts of factors.
Definitely.
Yeah, and there's informed choice. You know, as a clinician, I would say here are the 3 evidence-based treatments for PTSD, and here are the risks and benefits if you do one treatment or another treatment or a third treatment. And together, a collaborative process, we decide on what treatment might work best for you. And there should be ongoing assessment of your symptoms, your levels of functioning to see whether or not the treatment is helpful or not. And then one may need to pivot, you know, if the treatment is not doing well for you. So you have a choice. You can choose based on the best available information that we have about what works well for trauma. So we'll end here. It looks like we're at our endpoint. Thank you, everyone.
Thank you so much.
And I also know that we have some of your information, Dr. Rueglas, in the exhibit hall. Am I correct in terms of how to?
I don't think it's in the exhibit hall, but I will put my website for those who want to visit. Please stop by and visit. Perhaps Dr. McKay and Dr. Caldera can add their websites as well.
Yes, I just did.
Yeah, yeah.
I think you are in the exhibit hall, Dr. Rueglas.
I'm there, but when you click on it, it takes you to a video portal. There's no exhibit hall function under my.
Well, there's contact information here.
Is there?
Oh, okay.
Yes, yep. It's your logo, your name, your phone number, and also your email, your website address.
Oh,
Okay.
I didn't see that earlier. It must have been fixed. Thank
Mine
you.
should be there as well too.
Dr. Caldera and McKay, could you stay on for 2 more minutes after?
Yes, I can stay.
Yeah.
Thank you all so much for coming.
Goodbye, everyone. Thank you. Enjoy the rest of the conference. Take care.
Have a great rest of the day.
Enjoy the rest of the day.
Thank you, everyone. Please take time to visit. There's a couple more workshops towards the end of the event. If you have a moment, please visit gazette.rutgers.edu and learn about our programs and centers and our academic programs as well. We truly appreciate your participation in today's program. Thanks so much.
Thank you.
Thank you.
Thank you so much.
You're welcome.
Thank you.
I'm gonna stop the recording.